Thank you for the privilege of the podium, David, and that nice introduction. I'm really excited to be here. I think, I understand that I stand between you and a wonderful meal prepared by our outstanding chef. So I'll keep my comments brief, but what I wanted to do is take a moment to expound a little bit on why we are here. I sat where some of you are about 6-7 months ago and didn't really have a whole lot of information about Yoko Village or what it was. It sounded kind of cool, but I didn't know where it came from or what it meant. But I was in Philadelphia and had a call with Andre. And, after maybe a couple of convincing calls, he said, hey, you should come down. And so I did, and I sat, similar to as you all are, kind of thinking to myself, what exactly is this? Like, I'm not like that trippy spiritual type. I just kind of want to go and see sunsets, do yoga, and, live a long time. That was sort of kind of my mentality. But as the days progressed, I became deeper and deeper and more involved and interested on what this was about. And by the time I left, I knew for sure that I was in the right place. And now I'm here a second time, and my colleague just commented a moment ago, said, you look calm. Because they're used to seeing me busy and ripping and running, and it was just so interesting that even palpably, they could see a somatic change in me. And I think that if you all are conscious of how you feel now and how you'll feel by the end of the week, you may notice the same. That seems like a minor thing, but it's that somatic feeling of relaxation and comfort which will add days to your life, right? Think about that. So when we go back home, we're back in the hustle and bustle, but here, you're relaxed, and you're building community. And you start out with a little bit of anxiety because you're like, I don't know anybody here, I don't know what they're about, I'm not trying to smoke any weed or do anything crazy. But then you start branching out, you have a few drinks, you shake hands, you ask people where they're from, what they do, and that calmness comes over you again. Well, that's what we're trying to create as a lifestyle here at Yoko Village. But we understand that even with that as a lifestyle, there's still the importance of having guardrails around so that you can live healthy, so that you can bring your family here and they can also share into that health and wealth. David pointed out that I do transplants, and it's not, as glamorous as it may seem. And I mentioned this at the last Yoko connection. Every time I go, I kind of say a little prayer at the sink as I'm scrubbing in, and I go into the operating room, and a lot of times I don't even see my patients. They're prepped and draped and ready, and I just come in and I make the incision. But after the fact, I read the report as to why they died or what happened to them to put them in that position of requiring transplantation or being in a position to transplant. And every time I leave with a sense of gratitude, a gratitude for it being an opportunity for me to live life a little bit longer. And I think sometimes when we get busy, we forget about that gratitude. And so as I wrap this up, this part of the talk, and start the real talk, I want to remind you all to carry a sense of gratitude, because the clock is ticking and it may stop for some of us. But while it continues to tick, we want to do what we can to optimize the quality of that time. And so I want to, before I start with the next slide, thank Laurent and Andre for having me here, and then making it possible for all of us to come collectively in this communal space. The Yoko team for putting together such a beautiful program, which I'll go ahead and take credit for since I'm the first one speaking. But no, they're gonna do an excellent job. To my partners Arjun and Carlo, who are going to share some really interesting things that we're trying to accomplish over the next couple of months to years. And then I brought my own crew from Philadelphia who's supporting me in my endeavor, and I thank them for being here. All right, so revolutionizing health and wellness in Yoko Village. You already saw myself, Carlo, Arjun, along with LaRon and David. We've been kind of cogitating over this idea for the past couple of months of how to make wellness important. Yoko came and was established with the ethos of wellness, but there was really no kind of insight on what that would look like. And so we thought about maybe a health clinic, but people would ask, well, why do I need a clinic? I'm healthy, I'm just coming down to visit. But as David pointed out, how many of you feel comfortable bringing your family here? Or staying for a prolonged period of time. And anything can happen, from trauma to an accident, insect bite, to long-term chronic diseases that might need to be managed. And so we want for you to not only be able to come here and experience that calmness, but also have a sense of assuredness that there are going to be guardrails around for you to completely enjoy yourself. And a lot of times we go into spaces and not really clear as to what medical care is available. Well, we know that the medical care here is limited, and we want to change that. And so our mission is to empower wellness and nurture lives, which is a little bit different from the experience that many of you may have seen in Western medicine in the US, where the goal is to just treat and get out. And so we want people to live well and full lives. Yes, we have Band-Aids and we want to cover those, the scrapes and scratches when you have injuries, but we also want to provide adjunctive options to your wellness such that you can leave this experience and feel whole, feel as if your life has meaning and adding value not only to yourself but your community. And we hope to do that by providing comprehensive, personalized health and wellness services that will include both physical, mental, and emotional needs of the community. We're dedicated to fostering it in a way of a culture. And so a lot of times people concerned about health issues, they only think about their doctor as a person that will, give them medication, but we want to go beyond that. And oftentimes there are medical conditions that, just aren't, they can't be solved by a pill. And so how can we create an opportunity where you can come here, your family, friends, and others, and feel like people are taking good care in a vested interest of not only your physical health, but your overall well-being. And so Yoko Health and Wellness aspires to be a beacon of holistic health and wellness, transforming lives of individuals and communities through our innovative, integrative approach to care. Our vision is to create a world where comprehensive wellness is accessible to all, particularly fostering a healthier, more vibrant society, and we strive to lead the way in promoting physical and mental health. And so what our goal here is not only to incorporate traditional medical therapies, but also some alternative options. I know some of you have probably heard of the idea of psychedelic therapy, and people are kind of like, okay, what is that? What does that mean, and how are you going to use that? Costa Rica is kind of the centerpiece of ayahuasca and some plant-based therapies, and you can go out to the jungles and have experiences. And I think there can be meaningful spiritual opportunities in that way. But we want to be able to harness that power such that folks who are suffering from psychiatric disorder, addiction behavior, and other chronic or long-term conditions where they can experience that alternate opportunity of medicine such that they can leave healed. Not just a Band-Aid put on it, but leave in a way where they feel supported, where they're coached through their condition, and where people are following them thereafter to be sure that they're okay. There are a lot of ayahuasca retreats nearby and around where you go 7 to 10 days, drink a little bit of medicine, and then you go back home. But what happens then? But we want to be the supportive therapy there for you such that you have some guidance around, the medication, but also incorporating a complete wholesome lifestyle. And that's going to require a coach or a friend or a mentor that we'd like to provide and help guide you through the challenges. And so it's an innovative approach. Some would even say it's an expensive approach or it doesn't make sense. And how do you make it work in this way? But the three of us collectively have all had experience in providing medical care in resource-limited settings. So we've all gone to places where they have nothing and we've been able to make something of it. We're here at an advantage because you all are coming here with open minds and hearts, and you want to be healed, and you want to live healthier, and you want to have longer lives. And so with that as a foundation, our work is actually easy. David mentioned the Blue Zone, and it's kind of propaganda, but there is some research to support it. The Blue Zone, for those who aren't familiar with it, is 5 areas of the world where they've documented individuals who have lived the longest. They say sometimes the largest number of centenarians, or people who live to be 100, live in these areas. And the Nicoya Peninsula happens to be within one of those 5 blue zones, which is where Costa Rica sits. And so what better way to, really monopolize off of that experience of having the natural presence of the blue zone. Now, as a physician, I kind of, squint my eyes a little bit at it because it's the blue zone because it's warm and there are natural foods here and less crime and not a lot of smog in comparison to the US. But if you take that environment and you put people there and you build community and you provide them with everything they need, which outside of medications include joy and love and happiness, you really can see an appreciable change in how people live. Not only that, you can see a change in the quality of those individuals' lives. And so our attempt here with Yoko Health and Wellness Retreat Center is to bottle that up and to provide that experience for not only you all, but also the community. And so opportunities for enhancement of health and wellness exist in Santa Teresa. And we use this wheel to kind of, spell out what some of those opportunities look like. And they include not only kind of the spiritual and emotional, but there's also financial opportunity. And I don't necessarily mean that's, an investment, which that does exist, and we could talk about a little bit later. But, when you live well and you're comfortable, you can make more money, and everybody wants that because you have more money, you have more time. And then, just the other components that make a full life, those are all the pieces of this wellness that we are looking to incorporate. We have a business model, fairly simple. Anyone who has a talent or a skill, not interested in your money, we want your heart. And that's what's going to be the difference here. Your heart will help build the community. And there'll be plenty of opportunities for folks to come in as part of the team and help build. So I'm going to stop here, but I want to, again, remind each of you that your being here is not by a mistake. You're sitting here, you're listening to this message, and you're being a part of the rest of this week. And so don't take it as a coincidence. Really breathe in and enjoy the opportunity to engage either of the individuals that you meet here. And we hope that you will consider at some point coming another time and maybe even staying here. But I want you to be able to do so with the peace of mind of knowing that we will have in the very near future a health and wellness center that will be able to maintain your strength. And yes, you too. That will help you maintain a good quality life. So thank you all for your attention.